Bienvenue à tous. Welcome to Reporters here on France 24. I'm Mark Owen. In this edition, we examine Sweden's COVID response. Now, you could sum it up as herd immunity. No measures were taken at all the first time round when the rest of the world was locking down frantically. And while the Swedish Royal Academy supports the WHO's recommendations to isolate to stop the spread, the Public Health Agency in Sweden, which is the one that has all the clout, decided to apply another strategy. But the death toll made the government change its mind. Clovis Gasali, our reporter, has been there with Ashraf Abid. Clovis, what did you find in Sweden?
Well, coming from France, where we've had lockdowns, where we currently have a curfew, it was very surprising to see what we saw in Sweden. On the plane going to Stockholm, it was full of French tourists who wanted to enjoy the moment, the weekend in Sweden, a place where you don't see many masks, where restaurants and bars are open. It has to be said that the Swedes do respect social distancing. I've got Swedish friends who tell me that it's natural for the Swedes to do social distancing, even when there's no COVID. But the situation is very real with a lot of COVID cases, as you'll see in our report.
Clovis Gasali, Ashraf Abid, let's take a look then at that report.
They said that they were feeling a little bit ill, not very ill, no coughing, no fever and no breathing issues. And then 2 days later, when we hadn't heard anything from them, so we asked a neighbor who has a key to their house to check what was going on. And then the neighbor calls back and tells us that they have found my mother dead on the couch in the living room and my father almost unconscious lying on the floor in the bedroom. And my father was rushed to hospital with an ambulance and then after 2 weeks he was discharged and the doctors had said that he was no longer in danger by Covid-19. And then after 10 weeks we found him dead in his bed one morning.
Emma was herself infected and is now struggling with long COVID. She's getting as much rest as she can in her house 90 kilometers north of Stockholm while grieving her parents.
Well, this is a memory wall we created. So this is my mother together with my dogs, which she loved very much, as well as her grandchildren. And this is my father. He really loved gardening. Since they were taken away so suddenly and unexpectedly, I wanted them to be here in some way, not only for me, but for my children, who misses their grandma and grandpa very much. I believe that the Swedish strategy was to let this virus spread, not totally uncontrollably, but spread around society. And doing that, we lost many, many people, lives that could have been saved.
Many have accused Sweden of seeking herd immunity by taking a radically different approach to others. Neither a lockdown nor the use of face masks were considered effective in the war on COVID-19. Most Swedes back their government and follow recommendations, but calls to act responsibly and respect social distancing aren't enough. While Sweden's COVID death rate is roughly the European average, it's 10 times higher than that of neighbours Finland and Norway, Scandinavian nations with similar ways of life. In late 2020, infections increased rapidly and authorities reassessed their strategy, with a temporary pandemic law enabling some restrictions. Anders Tegnell is the man behind Sweden's strategy.
We have used less stringent legal measures and more voluntary measures, and that is very much because that is what the sort of legal requirements are in Sweden. We have had a great trust from the population in this and a great following on our measures. The measures have been very stringent, cutting down on the number of people they can have, how far they have been to sit apart, and also if they can serve alcohol or not. When we follow up with the regions that do the contact tracing, the message is that they very rarely see any spread that they can connect back to restaurants. So I think our belief and what we can say from the data we have is that the strategy to keep them open with these quite stringent measures, it has worked rather well.
A 5-hour ferry ride from Stockholm, in the middle of the Baltic Sea, lie the Öland Islands. 30,000 people live in this Finnish archipelago, and Sigrid has chosen to join them. This Swedish student attends all of her classes remotely and has no desire to return to her homeland for now. Her Finnish friends offer her the support she needs.
I'm new here,
Yeah.
and you're born here,
Yeah.
so
The biggest difference is that you can't go home to Sweden and visit your family and friends there.
Yeah, that's true.
Yeah.
Before the pandemic, I went at least every week.
Why don't you go back?
Because of the corona situation. In Sweden, the situation has been terrible. There's a lot of spread of the corona, but it also, and on top of that, it also feels like the precautions that they take feel inadequate. Here, if someone tested positive and you don't know where that came from, everyone that person was in contact into quarantine. I think in Sweden, anyone who's been in contact with someone who tested positive, they'll just be told to be careful for symptoms. So I feel like anyone I meet, if I go to Sweden, could be a carrier. They're not being traced. She's a lovely creature. If you want the people to stay healthy, then I think the Finnish strategy is better. If you want your entire population to get infected, then I think the Swedish model is absolutely adequate to achieve that goal.
I think that time will tell the answer whose strategy is the most effective. No one can tell today.
Oh, that was diplomatic. I
Yeah,
disagree.
I know.
I disagree. I disagree.
Öland blends Swedish and Finnish cultures, but the two countries' handling of COVID couldn't be more different.
Welcome to the government of the self-governed territory of Åland.
Knut Lonrot is an epidemiologist specialized in screening. He worked for the World Health Organization before moving to this quiet island where he's in charge of the Covid-19 response. Finland closed down schools and businesses right at the start of the pandemic. Sweden waited longer before taking measures, sparking concern among neighbours.
They may be Swedish citizens, they have a car registered in Sweden. They come here, people spot them as Swedes, and more or less clearly, fingers are being pointed and people are feeling really uncomfortable with that situation. And I think similar things have been reported across all the borders of the Nordic countries, this kind of stigmatization based on your nationality.
Only a handful of people have been hospitalized with COVID in Öland. Sigrid says she feels safe here. Every day, she chats online with other Scandinavians, comparing their country's strategies.
It has been a lot of conflict and resentment between people. A lot of people have different opinions within families, amongst friends. People have been divided. I have experienced I've lost friendships.
Often praised for its social model, Sweden isn't used to criticism from abroad. Some say that opposing its COVID strategy is unpatriotic.
A lot of people put a lot of trust into our government, into our authorities, and into as a bit of exceptionalism. You want so badly for the authorities of your country to be right, so you do not question the fact.
People in the northern countries are quite shocked and very sad. The best thing that could have been in the start of the coronavirus was the northern countries having the same strategy.
Yeah.
So we can have the open borders. We're living out of these tourists. They're coming here by the ferries, and it has been a lot of damage in our economy with the closed borders. And
Businesses near Sweden's borders have been hit hard by the pandemic. Malmö in the south of the country usually welcomes many visitors from neighbouring Denmark. Nidal moved to the coastal city a few months before COVID broke out and was shocked by the authorities' handling of the situation.
Sweden was like this carefree world, surreal, with everyone free to go out and work, absolutely no restrictions. So the other Scandinavian countries simply shut their borders with Sweden. It was really hard for French people like me. I lost my job in Sweden and had no way out, no way to find work elsewhere.
This French expat finally managed to find temporary work in the Danish capital, only 30 minutes away by train. But there are strict regulations to prevent the spread of the virus. Nidal must show a negative PCR test result.
So I did my test in Copenhagen, and then they sent it by email to my COVID passport.
COVID testing is free in Denmark and rarely the case in Sweden.
Now I always need to prepare well in advance for my trip. First, I prepare my passport, my temporary Swedish ID number so I can return to Malmö. Of course, I also take out a mask and pack everything in my bag. My PCR result is digital, so I have it on my phone.
Nidal travels to Denmark several times a week to work in a restaurant. It can only sell takeaway meals due to Covid-19 restrictions. Trains between Malmö and Copenhagen are frequent and busy in normal times.
Here we're crossing the border. We're arriving on Danish territory, so the mask is now compulsory, or there's a fine.
The border is closed to all travel deemed non-essential, and Danish police carry out random checks on board.
Next station is Copenhagen Central Station, and the train continues to Helsingør.
In stark contrast to Malmö, the shops in Copenhagen are all closed. Denmark is under strict lockdown with face masks mandatory in indoor public areas. And the COVID death rate here is 3 times lower than in Sweden. Nidal says at first his colleagues kept their distance when he came into work.
The Danes were a bit scared, but now things have changed. Because to go to work in Copenhagen, you need to have a COVID test done every 7 days. Now, there's a lot more trust.
Life in Scandinavia is much harder than he expected, and his dreams of discovering the region are on hold for now.
For the time being, I'm struggling to pay my rent, buy food. I basically earn just enough income to survive. I think we can say that my adventures in Scandinavia haven't really begun yet. I believe and hope that once this pandemic is over, my adventures will really start.
The pandemic has disrupted lives across Scandinavia, sparking divisions between nations with deep historic ties. Anders Tegnell, the symbol of Sweden's strategy, is a polarizing figure. His strategy has evolved in recent months, and many of his compatriots are standing by him. With the risk of a third wave of infections looming, Sweden's government is eyeing tighter restrictions. The possibility of a first lockdown is on the table, but only as a last resort.
Well, Clovis Casali is still with us. Thank you so much for that report. Fascinating stuff. I'm kind of wondering, how do ordinary people feel about the way the pandemic has been handled in Sweden?
Well, differently depending on the country you're in Scandinavia. We got to travel all around the region. Borders are closed, of course, but as journalists, we got special authorization, even though we did need a PCR test, negative, of course, in order to cross into different countries. In Finland, bars, restaurants are open, and that's, according to authorities, because they took the right measures at the right time, a lockdown very early on. Then in Denmark, I met with some Danish people who told me that they've been respecting confinement rules strictly. They hadn't seen for weeks friends, and of course bars, restaurants closed there. And then you've got Sweden, where a lot of people were asking us, why aren't you reopening your restaurants? What's the situation there? They were very curious to hear our point of view, also because in Sweden, people do believe authorities very much. They back authorities. There's a question of being patriotic or not. if you will, according to some at least. And then we were quite surprised because we spoke to restaurant owners, expecting them to tell us the government's doing the right thing, protecting the economy. But we met with quite disillusioned restaurant owners, notably in the old city of Stockholm. Take a listen.
We really need help because a lot of restaurants, it's family business, small places, they don't have any backup. So a lot of restaurants is going under right now. They tell us, be open, save the staff, and then tell all the other people that don't go to restaurants. Don't go there.
You get infected.
You get infected, don't go there. so I mean...
Double message.
It's very, yeah, really.
Yeah.
So Clovis, how's Sweden's economy doing, given the whole do-nothing approach was about keeping business going?
Well, of course, the Swedish economy is doing better than other economies in Europe and in the world, simply because they did not do a lockdown. The GDP shrunk by 2.8% in 2020, but there are kind of worrying forecasts for 2021 for Sweden because they are envisaging tighter restrictions. What's interesting with the COVID-19 pandemic is that you see that national economies are truly interconnected. Take Sweden. It relies heavily upon exports. So if the situation is not good in countries in Europe or in other countries who are usually importing stuff from Sweden, well, of course, that's going to be problematic for Stockholm, and that's what we're witnessing. But overall, they are doing better than other countries, even though, as you saw in the report, in cross-border areas, well, that's a problem with borders being closed. Workers can't go from one place to another. Take Norwegian shoppers who usually go into Sweden. They're not going in anymore, and that's a problem for the border towns in Sweden.
Clovis, thank you very much indeed. That's it for this edition, but of course you can see our report again via the website france24.com, the report by Clovis Casali and Ashraf Abid on Sweden's COVID response. This is Reporters on France 24. Do stay with us. Most of all, stay safe.